Good morning. We're back again. I'm Mabel Jong. Thanks for watching continuing coverage of the World Healthcare Congress here on WHCC TV. We're going to be talking about the work with codes, and we're going to do that with Sheila Shapiro, who's Senior Vice President, National Strategic Partnerships, Clinical Services at UnitedHealthcare. Sheila, thank you so much for your time.
Gosh, thank you for having me.
Yeah, so you spend a lot of your time at UnitedHealthcare thinking about codes and working with those. Tell me where you're at with that now and why it's significant.
Well, at UnitedHealthcare, we're really looking at redefining healthcare into whole person health. And one of the things that we've been doing over the last several years is looking at how we can capture information related to social determinants of health and take action on that information. And one of the key things that needs to be done in order to utilize information is to have a common language. And that common language that we are promoting is the use of ICD-10 coding. Those are diagnosis codes that physicians and the healthcare community use to share information with each other about an individual. Mm-hmm. Just like when you go to the doctor and they diagnose you with a condition, maybe diabetes, now everyone within the healthcare system can understand what that condition is and work to solve that problem. The same thing goes with the codes that we have been that we've requested from the ICD-10 committee to assist the industry in getting that common language by expanding those codes for social determinants of health.
Okay, why is UnitedHealthcare taking the lead on this?
Well, we believe that every individual, regardless of whether they are uninsured or underinsured, should have access to care. And that care includes social determinants of health. So we believe taking that information and being able to utilize it to help our members lead healthier lives is part of our mission. And in that regard, we have already had members tell us that they need assistance, and over 2 million of them so far have asked for that help. And we've been able to make referrals for over 1 million people already. That equates to over $250 million of social value to the people that we're trying to serve.
And so is the rest of the healthcare community happy to let United take the lead in establishing the codes for the social determinants of health area?
You know, we are partnering with many different organizations. We have a collaboration with the American Medical Association, the National Association of Quality Assurance, NCQA, our many state regulators, one of them being the Medicaid agency in Arizona, known as Access. We have the National Association of Community Health Centers, and many other organizations, including payers, are coming together to really think about how we simplify this work so it can fit into the workflow of not only health payers, but providers. So leveraging those ICD-10 codes that are used today for diagnosis actually creates that common language for the industry.
Okay, how far into the work are you now, and where do you want to end up?
So we know at UnitedHealthcare that this is a journey, and we have just begun to think about how to incorporate social determinants of health into whole person care. And we believe that redefining healthcare is part of our mission. As we have done this work, we've begun to partner with various social and governmental agencies to provide those referrals. That's where that social valuation also begins to play a critical component. So we have a patent pending imputed market price social valuation model that allows us to take that information around a referral and that fulfillment of that service, and understand how that affects people's overall quality and the outcomes that we're trying to achieve for the populations that we're here to serve.
But would that replace anything that's already in place now, or it would become a completely new tool?
It's not a new tool at all, and that was really what we were striving to stay away from, because we know that the system is taxed and our providers are already have a significant workload, which is why we were looking at the ICD-10 codes to leverage. There are existing codes around social determinants that many doctors already bill on their claim forms. The codes that we are asking for really are an extension of that to allow all of us within the system to help each other. So when we make a referral today, we're able to share that information back with our providers through existing mechanisms, not new tools.
All right, Sheila Shapiro, thank you so much. May I ask how you're enjoying the conference so far?
I love the conference. I think all the speakers are great. We really appreciate the World Healthcare Congress allowing us to come participate. UnitedHealthcare knows that social determinants are a critical part of people's overall health, and we are anxious to see that whole person care become a reality.
All right, Sheila, thank you again.
Thank you.
And I'm Mabel Jong. Thanks for tuning in.